I put together this presentation to not only provide an overview of what fascial manipulation is, but talk about how it separates itself from other fascial-oriented methods. I was speaking to a friend and colleague recently about a patient that they've been seeing. Despite their best efforts and intentions, keep having recurrent episodes with only short-term relief. Now, I get the opportunity to engage with clinicians from many different professional backgrounds. And despite there being differences in the treatment modalities we may use, whether that be related to manual therapy, exercise, education, this is a common experience that we all have. And it certainly makes sense for something like low back pain, considering that most low back pain is non-specific or myofascial in nature, whereby there's an insidious or non-traumatic onset. And part of understanding fascia and the application of that in fascial manipulation is fascia provides an anatomical framework for how the body's connected. And that's really important because to better treat musculoskeletal pain or dysfunction, we need to understand not just what the symptoms are, but where the root cause of the problem is. So consider the patients you work with. They all have a story to tell based on their past medical history, and that varies from patient to patient. They may have old ankle sprains or other type of muscle strains. They may have had surgeries, be it musculoskeletal or non-musculoskeletal, or they may have overload through their myofascial system from certain physical activity or sport. Now, all of these types of problems can create dysfunction within the fascial tissue that can affect biomechanics. It can lead to dysfunction not only within that area, but also in other adjacent areas that can contribute to someone's presentation due to understanding the connections of the fascial system. Now, fascia is becoming more and more discussed, but the other thing that I'm seeing is there's not a lot of specificity given to the type of fascia we're talking about. Because despite it being all connected, there is organization within this complex system, be it, say, the muscular fascia, the visceral fascia, or the superficial fascia. And these tissues all have a different anatomy and different role in the body, and understanding this can help us to understand what particular tissue is involved in someone's presentation. When we think about the muscular fascia, we can think about pain, weakness, or stiffness. And when you think about things like the retinaculum, which are thickenings of the aponeurotic fascia that surround our muscles, that can lead to disruptions in balance or altered proprioception. When we think about the visceral fascia and its relationship to the muscular fascia, we can better appreciate visceral referral pain, but also understand fascia's role in contributing to internal dysfunction and compensations within the myofascial system. And with the superficial fascia, that's where we find the lymphatic and adipose tissue, and also where we see the cutaneous branches of the nerves that can contribute to dysfunctions at the superficial layer, and understanding its contribution to providing sensory feedback to the autonomic nervous system. Now, the other thing that's really evident when talking to practitioners about fascia is the vague or non-specific nature in which we talk about treating fascia and what we're doing. Often you'll hear terms like release, which don't really describe the specific changes that are happening in the fascial tissue. Now, whilst we can have things like fibrosis or scar tissue form, it's actually quite uncommon. And it's really some of the research from the researchers from the Fascial Manipulation Institute that have helped us to better understand the role and the dysfunction that can happen at the loose connective tissue, the substance between the layers of fascia that can become dysfunctional based on someone's previous history, and also something that we can then understand from our palpation, feeling changes in fascial mechanics or sliding, and more importantly, how we treat that. So when I talk about fascial manipulation, don't think of it simply as a treatment modality. Yes, we need to think about different treatment modalities depending on the layer of fascia and how we address and restore normal fascial biomechanics at the loose connective tissue. But fascial manipulation is an international community where we have practitioners from dozens of countries around the world. And we also have a research team intimately connected to fascial manipulation that are not only providing pioneering research about our understanding of fascia when we think about anatomy, biomechanics, and pathophysiology, but how that helps to form the foundation to the fascial manipulation method. And then more importantly, as I've highlighted, understanding that it's an assessment framework, because to better treat problems in the human body, we can't just think about treating the fascial tissue where there's symptoms, but trying to find the root cause or origin of the problem. Now, fascial manipulation is taught in 4 levels, and level 1 and 2 develop the musculoskeletal model. So in level 1, we learn about the fascial planes and the intimate connection between fascia and muscles associated with a particular direction of movement. In level 2, we learn about the fascial diagonals and spirals that helped us to better understand complex movement in the human body. And then in level 3 and 4, level 3, we learn about the connection and continuity of the visceral and muscular fascia, which builds on the level 1 and 2 content. In level 4, we learn about the superficial fascia, its mapping, and how we better assess and appreciate the superficial fascia and its contribution to the regulation of the autonomic nervous system. So, to give you a brief background of who I am, my name is Jack. My training originally is in physiotherapy, but I've certainly extended my knowledge beyond a lot of the conventional practices in physiotherapy, including fascia and fascial manipulation. In the last 4 years, I've taken a real deep dive into fascial manipulation, having been involved in the first international school program that's taught over 3 years, based out of the Fascial Manipulation Institute in Italy. This is an opportunity where I've got to work directly with Professor Carla and Antonio Stecco, who run the institute and have been pioneers in our understanding of the fascial system. Through that process, I've also became nominated to become a fascial manipulation teacher, of which I completed in 2025. And I'm very proud to say that I'm the first and only fascial manipulation teacher now here in Australia. Now, the fascial manipulation courses are taught now in a hybrid format. So this hybrid format covers online content that forms the scientific foundation to the fascial manipulation method, and these are presented by Professor Carla and Antonio Stecco. And then we come together in person for 3 days to learn all the hands-on component of fascial manipulation, including the fascial planes in level 1, the assessment and treatment process, and its application to our clinical practice. And to help support the fascial manipulation community here in Australia, these courses also include live webinars to be able to review content and go over case studies. And throughout the year, I run in-person revision workshops where we can come together to review the content and make sure you continue to refine the application of the method to your clinical practice and better improve outcomes with your patients. So level 1, we learn about the fascial planes and the specific points within these planes called centers of coordination, of which there is one in each segment of the body related to each direction of movement, and when combining them, develop the fascial planes. I also run these introductory workshops that are giving people an opportunity to dip their toes into learning about some of the basics of fascial manipulation. So these are one-day workshops where I'll cover some of the basics in the science related to the anatomy, biomechanics, and pathophysiology, and describe some of the basic palpation and treatment concepts. So when I think about defining fascial manipulation, don't think of it simply as a treatment modality. Absolutely, we need to understand what are the required forces and what are the required depths to treat the different layers of fascia. But really, it's through understanding how we can develop a systematic approach to how fascia contributes not only to pain and dysfunction, but how people's past history, people's story give us indications of where we need to understand where the origin of the problem is to not only simply treat the symptoms, but make sure we address the cause. If you want any further information about the courses or the introductory workshop, visit our website at melbourneathleticdevelopment.com.au. And on there, you'll find under the professional development tab, the fascial manipulation courses for further information about dates and signing up. I'm also very open to people contacting me directly. So you can contact me on education@melbourneathleticdevelopment.com.au if you want to have any further discussions about the research coming out of the Fascial Manipulation Institute, information about the courses, or having a better understanding of what's involved in the fascial manipulation method.